the mindset that needs to change, that an internal auditor is someone who works with you periodically. It could be even weekly, monthly, quarterly. By the time the auditor general, or they can now people come, these are things that the internal auditor would have raised and already reviewed and a follow-up done at that point. Ishmael.
Thank you, Dr. Moni. I think this issue of the role of the internal auditor, it usually affects quite a number of officers from the various support departments. And what we need to realize is that, is there an echo, or you can hear me properly?
No, we can hear you.
You can mute. Okay, fine, Dr. Tari, you've muted your mic. I was saying the role of the internal auditor need not to be re-emphasized, because the internal auditor is part of us in an institution. He's one of the person who is supposed to be helping us in improvement, continuous improvement. His work is to ensure that where we are making mistake before the external auditor comes in, we are able to make corrective action even before we have the Auditor General's office on site. Remember, one of the references when they come is the internal auditor's report. And what we need to do to appreciate their work, and this has been now been put in the audit committee guidelines, is that the role of the internal auditor has now been enhanced through the Public Financial Management Act audit guidelines for 2016, because their work is in terms of, it's about quality assurance. Are we really doing the right thing? So the issue of the question was posed about perceiving the auditor like coming in like to each hand. He should not approach his work with a mindset that he's coming there with a feeling that the things are wrong. He's not a watchdog. He's no longer a watchdog. He's part of the team and should be able to help in improving the systems of an institution. And I think once we appreciate their role, by the end of the period, then we should be having good quality financial reports if we appreciate the function. Otherwise, the internal auditor, just like the external auditor, should be guided by the professional ethics of the profession. The expectation of the client, who is the institution, is no less like the expectation of the same client when the external auditor is coming, because both the external and internal auditors have the same qualifications. Dr. Moni, I believe I've also re-enhanced on that.
Yes, Ishmael, thank you.
Okay. The next question again on it's still relating to the internal auditor. What of internal auditors who collude? This is to Dr. Moni. What of internal auditors who collude and share confidential information with other staff in total disregard of the rules of their profession? That is the question. One of who is guided by his emotions and personal religious beliefs in work. What action can institution take against them in both instances? Dr. Moni, you can have a take first.
Thank you, Faith, for the question. And if you look at the Public Audit Act, or number 34 of 2015, the code of conduct of public auditors is clearly spelled. And one of the things that it brings out clearly is about the confidentiality, the objectiveness of the auditors, both internal and external. So in such a case where someone now goes contrary to the laid down code of conduct regulations as an auditor, there are also sanctions that are meant for the particular auditor, because that is breach of trust between the auditors and the auditees. And most of the times I've seen these issues about the trust come up. You remember the issue that we had in the Ministry of Health. And you remember the auditor, before even the report was now confidentially given to Treasury, it was already in the media. The fourth estate was already out with the report, the contents of the report. They were out to say that this is what happened. But at that point, the accounting officer had not even seen the report. The act is very clear. There are disciplinary actions that are supposed to be taken against the auditor. I know sometimes we always keep on asking, yes, this is in theory, this is in paper, but how many people have been subjected to the rule of law in such cases? When you look at the regulations, like Ishmael said, the role of the auditor has been enhanced. And that is why currently they report administratively to the accounting officer, functionally to the audit committee. And there's a bit that is coming with a lot of drama with the auditor, maybe the auditor now, the person in charge of the internal audit, has direct access to the chairperson of the audit committee. And that has brought a lot about issues of trust. Is there something that they are sharing with the chairperson of the audit committee that they're not sharing maybe with the accounting officer in this case? If you have to share any information, because whether it is confidential or not, because this is a report, before it is disseminated now to the departments, it must go through the chairperson of the audit committee, who will now have a discussion with the accounting officer, where now the accounting officer is held accountable. And at that point, now the accounting officer can now call the head of the line departments to tell them this is the action, the follow-up that is expected. We will come to review this. About people being guided by their emotions and personal religious beliefs in work. That is why even the code of ethics for public persons is clear, that we are all guided by the code of ethics. Though we've seen in some instances, some people are driven by their emotions. It supersedes your objective, maybe analysis of a situation. And these are not the right people maybe to deal with. But as auditees, the question is, when you get someone who is so emotionally charged in an audit process, then what do you do? Do you also become emotionally charged? Do you bring in your religious belief also? What do you do in such instances? In fact, there are the auditees who sometimes will bring a lot of sense to what the auditors are doing. And I know not everyone is a finance person, and I may not keep on bringing out about the regulations and all that, but they are guided. The question is, do we practice what we put in theory? Because even us as public officers, we are also guided by a code of conduct that we know this is expected of us. When you now look at the case of the MOH, the Ministry of Health, you remember what happened to the case of that auditor? It was a senior person almost retiring. They were brought out in the media, so much is spoken about it. The next minute, the Treasury says, we are the people in charge of internal auditors in ministries and departments. We are recalling that internal auditor back to the Treasury, then we will deal with them. We are not privy to what happened beyond that, but then there are disciplinary actions that are supposed to be taken against that person. But I normally say it should not be a point where internal auditors or the person in charge of internal audit now sings the tone or the tune of the top management to be always on the right part. Sometimes if you feel that whatever you give in the reports is not done, there are no reviews, there are not actions, there are no follow-ups, then you can use the right channels to have this information disseminated to the right persons in the departments. Because I know one thing is at the end of the report that is disseminated back to them, even the management, let alone, the accounting officer usually has a forum where they call the heads of the departments, the head of internal audit, then they'll have a discussion and agree, these are your audit queries, then answer them or give back the response. But I advocate for objectivity in what we do. Thank you, Ishmael.
Thank you, Dr. Moni, on the issue of the audit. I think to add on to what you have discussed, the issue of handling the internal auditor, be it the internal or external auditor, is quite an important issue, because for managers who are sometimes supposed to prepare audit files, who are supposed to give responses to these auditors are also human beings. Remember, we also have situations whereby the auditor has given his issues. Managers are supposed to respond to the queries raised within a particular number of days, within 7 days, within 14 days. But we also reluctant sometimes to respond to the queries that they have raised. And therefore, the issue of relationships, how do you relate with the auditor? Be it an internal auditor, be it an external auditor. How do you prepare the responses? Can also determine or influence the relationship or what you are calling emotion. Sometimes you look at the reports from the managers and how they You see, you also like, you don't appreciate that his work is also going to be measured. He's informed by an audit program. He has a timeline. He has deadlines to meet. I think we also need to address the issue. How do we relate with them as officers again? Because we also want the auditors to exercise their professional duty of care and fiduciary responsibility in terms of confidentiality of documents that they come across. But once we give them support, and again, then we also equally expect them to give us some valuable work, be it at internal audit level or at the external audit level. So how we relate with the auditors, how we prepare the files for them, can influence the reactions of the auditor, be it an internal or an external. So as a manager, I would advise that we go a notch higher. You remember, some of the profession may not have some soft skills training, like perhaps what we have gone through here as manager. There could be internal auditors in this forum, but I know there could be some module here where you have learned quite a number of soft skills on how to relate with other people. Emotional intelligence also matters. When somebody approaches you this way, there is a way you deal with such individual, but work must be done. Thank you. The next question, Tim, is on still on audit. One of the participants discussed auditing of drugs in a pharmacy. As a professional auditor, how do you ensure audit techniques areas like in pharmacy is done effectively? Why? Because most auditors are accountants that lack expertise in the field like mining, survey, etc. What has the government put in place to build the capacity of auditors so that they can be proactive in fraud prevention? Dr. Moni?
Thank you, Sally, for that question. And when the Public Audit Act of 2015, most auditors are trained accountants. So if I'm sent to audit maybe an hospital, maybe a building, I may not have that skill to understand maybe about the BQs, to understand issues about the drugs and all that. And it clearly now spelled out the guidelines that if you are auditing in a very technical area, for example, in a pharmacy, this is a medical field, they've given a list from the Doctors Association. In fact, what they normally do is say that you can approach the Engineering Board of Kenya. These are the guidelines that are given. You can approach the KMPDU. These are the guidelines that are given. For the associations of the specialized areas, then you get someone from that. If it's an engineer, it's a doctor to help in the audit for that particular entity, because they realized, and this is true, you cannot pretend that you understand issues about medical terminologies, jargons, if you are a trained accountant. Yes, there are things that maybe the doctor may not understand when it comes to audit, the scope, the strategies, and the rest. When it comes to the specialty, then the medical field now is supposed to provide, and the guidelines are given in the Audit Act. The same happens for the Engineering Board of Kenya. They are also part of the list. That if you're auditing a highly specialized area, we must accept that you cannot be a jack of all trades. You cannot understand all the areas. But because you are the person now leading the team, the doctor now will help you in coming up with the report, understanding if it is issues about drugs, stock taking, and all that. Then they break down it for you. But then as the auditor, you take lead. You don't let them now run the show, but they must be there now to guide you. And that is why the Auditor General's office is clear. If this is a specialized area, we have these guidelines. There are these associations, they're supposed to guide us on the same. And about being proactive in fraud prevention, there are so many loopholes when it comes to audit. And that is why when we began, and you look at the slide that you are talking about, it's more of a risk-based audit now. You must look at the risky areas. That is why we are coming up with risk assessment frameworks, the risk policies, the risk registers for all the departments. You must know what are your weak links. And you must have the mitigating factors in place, the strategies in place. The risk champions are there. They will always be proactive. They're not just the knee-jerk reaction, of course not. And the building of the capacity of the auditors. I remember the current Auditor General, the appointee now, Nancy, has been working closely with the school. And one thing that she raised is the capacity of some of the auditors, that we must keep abreast of the technology. You cannot just continue auditing things like you audited 10 or 20 years ago. The volume of the data that you're now dealing with is just massive. And therefore, you cannot just simply say, I'll still continue using the manual audit style. The question is, how many of the auditors are willing to learn? Because you must be a learning person to move with times. The velocity, the volume, the variety of the data is now too much. About technology to audit, there are softwares that have come on board now that can help you audit. The computer-assisted audit techniques, they are there. So it is a question of, then who builds the capacity of these auditors? Who ensures the auditors are constantly building in terms of their capacity? I know other than ISPAC, that is the umbrella body for the accountants, there is now the Internal Auditors Association that has also come out strongly now to help train their people. But remember, these are they're just trainings that are normally just CPD programs, just for your own career progression, but not entirely on knowing what are the new technologies, what are the new issues that are coming on board. I can comment that the association does a lot, but it is also the initiative of the particular auditors to remain abreast of what is happening. Thank you, Ishmael.
Thank you, Dr. Monyi. Maybe one or two issues I can add is that a professional auditor is who is competent and owes the duty of care to the client should not accept an assignment which he knows is not professionally qualified. For instance, if you're going to audit maybe Telkom Kenya, and I'm supposed to audit on the server, and a small fuse may cost millions of shillings, and then I'm supposed to go and audit the server. And as what Dr. Monyi has said, during the gathering of the audit evidence, you are supposed to, there are various procedures, and one of it is about inquiries. And these inquiries is from the experts. There you must bring in the issues of the engineer to come and tell me and advise me. What is this fuse that caused this much? And therefore, the judgment of the auditor will be informed by the input of the expert. And that way, he'll be able to come up with a conclusion of an opinion that has some basis in terms of opinion. And that is the way the auditors approach their work. Where they have the level of incompetence, or they are not competent in an area, the procedures of the profession allows them to seek their assistance or make inquiries for support so that they can corroborate their findings. Thank you, Dr. Monyi, for that response. The next question is on is Susan Chesang on board? Susan
is on board. She can answer the procurement question.
Yes, Susan, yes. Is she there? Okay, Susan, there is a question on procurement. There is always this reluctance in serving in tender committees due to let's mute our mics, please. Let's mute our mics. There is a tendency to be reluctant to serve in the tender committees due to personal responsibilities. In fact, procurement committees, the person who says that he has noted that people, some persons keep absenting themselves and sending apologies until they are eventually replaced from the committee. Why is this so, Madam Susan Chesang?
Thank you very much, Mr. Maingi. Yes, that question, I don't know. The question is touching on the responsibility, and for me personally, it is a matter of, it's more of administrative, because being assigned a duty or a responsibility by accounting officer to be in the evaluation committee, it is not supposed to be at your will. because as per the Public Procurement and Disposal and Asset Disposal Act, the accounting officer is supposed to appoint tender evaluation or an evaluation committee or a procurement committee or inspection and acceptance committee, and that is his responsibility. By appointing you as a member of any of these procurement related committees, it is his responsibility as accounting officer to, it's like assigning duties. It is part of your duties. Remember, when we are employed, we are given all our duties and any other duty that may come along. Now, I don't know, maybe the person who asked this question had something in mind or something different, but for me, if you are assigned that responsibility, which is actually for a certain period of time, you are supposed to do it and complete. And remember, the procurement or evaluation process as per the Procurement Act is within a certain period, which it should not go beyond 30 days. So I don't know, maybe the person who asked the question could maybe elaborate, because according to me, that is administrative and it is more of something that administratively an institution can ask why. Someone should actually indicate why he's not doing this work within the time that he's been given.
Perhaps, Madam Susan.
Yes.
The person asking the question is saying they keep absenting themselves, sending apologies,
Yes.
perhaps as a compliance issue, so that finally they are replaced in the committee. The question could be,
Yes.
is it risky, perhaps, to be a member of a tender committee? Maybe that is how I'm reading the mind of the person who asked this question. Maybe is it a risk to be a member of the tender committee?
I actually thought so, but I really... Okay, Faith, go ahead. I think you are the one who asked the question.
Yes, I was. And okay, it's something that I normally hear. Okay, previously where I've worked, several places where I've worked, if you're not comfortable, someone would advise you, why don't you just keep absenting yourself? But now that I'm going into management, I now want to know, how do you handle now people like me who are former staff now, who keep, okay, maybe they might not be happy with how the procurement process is going. So instead of just saying I'm not happy or let's change, or they feel like even if they say they have reservations, they're not being heard, the best thing is just to say, maybe that day I'm going to hospital, my child is sick, such excuses, just to avoid signing the minutes that you are present when that procurement was done. But now as a manager, I want to know, how do you handle such an officer who keeps absenting themselves, and how do you prevent that? Thank you, Susan.
Madam Faith, perhaps to add on to that, to try to respond to this question, I think it is also important to look at the bigger picture. Perhaps this is just one of the symptoms of an underlying problem in terms of organizational culture. If the culture of the institution is such that a meeting is held, a tender committee is going on, even before the deliberations are finalized, some members of the tender committee are already communicating with some of the tenderers. It's very risky. You've heard it has costed people their lives because of this tender issue. You know how it is. There's a lot of vested interest in these public projects. So it depends on this could be symptoms of other underlying issues that need to be addressed at institutional level, because if the information is leaking, and if you are a member of that tender committee and you are the one who is questioning the rationale or the failure of the technical competence of a particular vendor or a particular supplier, then this kind of information leaks out to the members of the public. It may even cost somebody's life. So this could be a symptom of another underlying problem that needs to be addressed. Susan?
Yes, very well. I really agree with you, Ishmael. And I thought that is what Faith was trying to say. It's only that she was not coming out very clearly. But from what I'm reading, also from the question, is that people normally run away from procurement-related committees. and it's because of so many fears. Now, depending with the institution that you're coming from, I think, I don't know, because if this is the trend, then there's a problem with the management. Because to me, if you're given a responsibility, imagine that letter of appointment is actually signed or approved by your CEO. And here, Faith, you're saying you're looking for a reason why you are not available. I think when you look at it as a manager, you should find a way of actually bringing out those disciplinary issues that has to do with would I say that not doing what your boss has told you to do. I don't know how it comes, because maybe Dr. Moni.
Yes, Susan.
Maybe from the management point of view, how would you handle someone who, you're given a job to do by your boss and you fail to do? Because that is actually what Faith is trying to ask in this. Because it is so clear that the person, the person appointing you to this committee is the CEO. If you run away from this job, it means that you are not showing respect to your boss.
Susan?
Yes.
You can hear me? Yes. Now, one thing that comes out clearly, even from the regulations, the public procurement regulations of 2020, it is clear who are supposed to be members of the tender evaluation committees, isn't it? And
yes.
I've had the opportunity to sit in several of those committees. And one thing that I realized, and that comes out strongly, the moment someone who is not competent is appointed to those committees, you will always see the unease. They would not want to be part of it. And that is why it is most clear in the regulations that the members of those tender committees should be heads of departments. Susan, am I right? Or senior persons for that case. Because these are people who understand the procurement process. These are people who understand their role in the tender evaluation committee. These are people who are not likely to be swayed, though procurement is one of the most difficult areas to operate in. But from the management position is simple. Even you as a manager, Sally, it should always come out strongly that anyone you appoint to those committees should be someone competent enough to say, if anyone comes and asks me, why then did you award this tender to this particular bidder? I can stand and say they met all the evaluation processes requirements. We did all the mandatory requirement analysis or evaluation, and I can stand by my word and say, I personally looked at the validity of the documents they gave us. So the question you must always ask yourself as a manager, am I appointing someone I know is competent enough to do that work? Because again, if you appoint me and I'm not competent, I will feel there is always that personal responsibility that anytime, because as a chair of the tender committee, you must also sign before the professional opinion is a report. You must do a report to the head of procurement. So your members must also be signatory to the report. If there were members who are not so comfortable or were not so competent in carrying out the evaluation, then you as a manager also fails. If there is someone who is absenting themselves and you know are competent, then the normal disciplinary action takes place. But the whole thing starts at appointing the right people to sit in those committees. Thank you, Susan.
Thank you so much.
Thank you, Susan. I think to add on to what Dr. Moni has said on this procurement issue, I'll still go back to Kacha and say the tone at the top can also influence the behavior of the members appointed at the tender committee. Because if you have the top is a domineering and would like to know what is happening in those committees, many people will not be willing to participate in the deliberations of the tender committee. If this is the kind of leadership that will have interest to influence the outcomes, usually, of course, human beings whom they are, they will resist and perhaps give reasons, absenting themselves on what Faith Sialai had said, and always look for other frames a reason to abstain themselves from the tender committee. So it's an area that can be looked at from a different perspective, in my view. And if anyone from the floor, maybe any procurement on the board, participants, to give their experience, share experience. We are dealing with managers here. This is not an induction. Therefore, I would like the managers also to give us their experience. Anyone? Florence Nyendo? Charity Kikonje, yes, please proceed.
Yes. Okay. As a point of
you are breaking.
Finance officer, when I see procurement process. Okay, I'm breaking. Okay.
Yes, please.
Can you hear me now, maybe?
Yes, you're okay now.
Hello. Okay. I was saying, for a person to be in the evaluation or in any committee in procurement process, what I understand is that they should be people who are competent enough, though it should not be it should not be mandatory for them to be head of departments, because if you are an officer in a public institution, you should be versed with the Procurement Act to be able to understand the act well, so that you can be competent even in the position of any rank as an officer, to be able to be competent enough. I believe there are other departments which don't take place in the procurement process, but I know of finance, they have a part in it, accounts, some of them in the inspection committees. So what I believe in is the competency level of the officer to be able to read and understand the guidelines and the policies and the act itself, the Procurement Act, so that they can be able to be competent even in the situation where there is a conflict of interest by the participants. They can stand firm and understand and make them understand that they should not be appending a signature in something which is having a conflict. Thank you.
Thank you, Charity, for that contribution. Competency is an area that also may influence. If somebody is not competent, then why risk? And the consequences are very clear. And the law says ignorance has no defense. You cannot later on say, I was incompetent in procurement matters. That's why I participated in the decision. Any other manager to give us some input? You can see Lennox Kapuga. You are appearing in the middle of my screen. Can you give it a try?
So, okay, I'm a pharmacist.
Yes.
And mostly what I can say, I'm involved in procurement of drugs. So there are times when we cannot get a commodity from the KEMSA, the authorized body, and we have to procure from other entities.
Okay.
And so I've not been to a point where I have to do the tendering and the rest, because we are normally told to limit ourselves to like 30,000, because now we don't have to follow the procurement procedure.
The low value procurement. Low value procurement, 30,000.
Yes.
Okay. But do you develop the specs?
So we normally just we are normally limited to that window, so that we won't have now to follow that tedious process.
Thank you, Lennox. Any other? Shiko Ndegwa. Shiko Ndegwa, you give your input. Immaculate Rubo. Shiko.
Yes.
What is your input with regard to the tender committees?
Sorry, I must have missed it. I was putting the young one to sleep.
Okay. The question is, why are people reluctant to participate in tender meetings, tender committee meetings, or to be members?
Yeah, maybe because of conflict of interest most of the time. Probably someone might see you influence the process and made one party win over another. My opinion.
I think.
Ishmael,
Yes, please, Susan, please proceed.
I feel like I should share with the participants.
Yes.
Understanding the process right from the beginning is also key in actually identifying who actually should participate in the tendering process, especially at the evaluation level. Now, when we do understand right from the planning what we need, and after that, identifying the items that we really want to buy. Now, as a user, let's talk now of Lennox. Maybe he's saying now is not involved in that tendering, but time will come where maybe at senior level he'll be called upon to give his inputs on maybe a certain drug that he needs to buy. Now, from the procurement process, right from after we plan, we actually and schedule when to buy, then we are supposed to come up with the specs. At that point of identifying the specs, that is when we have competent people. Most of the time, the issues that we are having in procurement is because after a document has been done, people from, nowhere are brought to come and do the evaluation. And these people have no idea of actually the item that we really want to buy. And that's why when you look at the procurement process, the cycle is actually right after planning, we actually identify the specs. That's when we develop specs. After developing specs, that is when now we go out, look for the bidders. At this stage, we actually let the bidders know what we want and having put down the criteria of actually identifying these bidders. Now, at the evaluation committee actually in ordinary straightforward process should be so clear, so that if you are appointed today, your work is only to look at what the bidder is giving against the criteria that we had set for this particular item. So now, one thing I feel like Faith is actually has gone through or she has seen before is because from nowhere, a procurement is being evaluated and people are pulled. And these people do not understand the whole cycle of the procurement. So if we identify the specs at the beginning and we have evaluation criteria put right, then these people will not run away. And then again, in as managers, it is very important to keep empowering people. You know, like I normally tell people, procurement is everyone in the government is a procurement, should consider himself or herself as a procurement officer. Reason being, at any given time, you buy. And again, going back, using an example of Lennox, he's actually a buyer. He's actually a procurement person because he's buying low value. And for him to buy this low value, he must identify the specs that he needs to have, this item needs to have for him to get it right. So I actually Faith, what is important as managers is actually to take or to empower people or build capacity in the people who are always involved in even simple procurement, like even low value procurement, so that at any given time, you can have a number of people to participate. Another thing that I've seen in many institutions is that now identifying few people to be the ones doing this evaluation. That tells you that not everyone understands the procurement process. Like, for example, every other time there is an evaluation, you'll always see Faith in it. You'll always see Wanja in that evaluation, because others don't even understand what this procurement animal of evaluation is all about. The only people normally think that you go there and actually choose the bidder that you want, but they don't know that there's a process that is that involves the whole evaluation process. So I think, Faith, the most important thing is actually to build capacity and to enhance people's knowledge and understanding. And as I said, every government officer is a procurement officer, because in one way or another, you are involved even in choosing or planning for an item or thinking of an item that you need to buy to support your work. Thank you very much, Ishmael.
Thank you, Susan. Thank you, Susan. Thank you so much, participants. I think we have another last question on procurement. And the question is about disposal of items, disposal of assets. An accounting officer is usually the one who approves disposal of items. In what instances is the board's approval necessary? Susan, you can attempt.
Now, there are two boards here. Before the procurement, the definition of who should be in the disposal committee, there used to be a team called Board of Survey. So I don't know if this question is touching on those Board of Survey or it is the Board of Directors, the senior management of an institution. But then if it is the senior management of an institution or the Board of Directors, the law is not actually picking on them on when to approve the disposal. The law is so clear. It is saying that the accounting officer shall appoint disposal committee. And this disposal committee, identify the items to be disposed and propose the method of disposal. And this method now is given to the CEO, who will either accept or reject the proposal. Yeah.
Okay. Well, Faith, I hope it is. Is that was the question raised by Faith? Was it Faith? I believe that is addressed.
Yes,
We don't have any other question in Faith. Was that your question? Disposal of items?
yes, it was, and it's addressed. Thank you.
It's already addressed. Okay, that's fine. From the look of things, we almost there. We seem not to have any other area of concern, perhaps because maybe our colleague Dr. Mumo addressed the issues of program-based budgets and budget and budget control. But my challenge is to the participants, perhaps, is to make sure that you go through the PFM again, look at the emerging issues, interact with the material seriously, because now we are coming to the tail end of the program. We're almost at the exam time. Please interact with the areas of program-based budget. What we'll be looking for is a practical application in project management. How do you execute projects that are program-based? How do you manage budgets in terms of budget execution? What are the controls? If you are the manager, what controls are you going to put in place to ensure successful implementation of your project? Then the issues that have been raised today with regard to the audit. Look at the audit practice in government. What has been the challenges of the Auditor General? Do you think they are doing their work right? Is there something that we can change in approach? This is the area that we are interested in terms of application and transforming the finance management. So let it be clear that you are expected to have an application orientation on the interaction that you have had with the public resource management. Because as I introduced, the resource management, public resource management is very key, and without it, everything else will not move. You'll not be able to facilitate others. And before I invite for a closure, I may invite Dr. Moni for some few remarks on public resource management, then Susan, then we can invite one or two participants to make their remarks. Dr. Moni? Dr. Moni? Susan, you can start off as Dr. Moni prepared.
Thank you so much, Ishmael. Yes.
Yes,
You
I can hear
me?
you, Dr. Kari.
Yes. You can hear me. Okay, thank you so much, Ishmael and participants. One thing that I normally tell participants and my colleagues is that public finance is one area that is highly regulated by the legal framework that we cannot go out of. That sometimes you cannot say, I'm not an accountant, I'm not a finance person. You must always acquaint yourself with the legal and the regulatory framework when it comes to public finance management. Today, you may not be the accounting officer in your entity, but soon as a senior manager, you will be there. Because every time a question comes, like this question that we are deliberating about the composition of an evaluation committee, it's clear in the regulations, section 29. It says that they must be always appointed on rotational basis, comprising of heads of user departments or their representatives. It's clear. And then professional consultants where it is required. All the time you will have your doubts, you'll have your questions, whether it comes to the budget, whether it comes to the cash flow plans, to the projection that you need to make, anything procurement. Please take your time. Don't say I'm not a finance person. Acquaint yourself with all the finance documents, the much you can, because we will always hold you accountable as a manager, as the accounting officer. I wish you all the best. Like my colleague said, we always look for the practical part of your answers. Please don't go theoretical. I was looking at the answers you are giving for the issues that we have between auditors and auditees, and you could definitely tell someone who's from the medical field, someone who's from this other field, because of the responses they are giving. It is that what we look for in participants, that when you walk out of these SMC platforms, you can say the networking, I've learned, I've shared experiences. That is what is the most important for us. Thank you so much for the time. I wish you all the best.
Susan, some few minutes, 3 minutes. Susan Chesang, any remarks you want to make? Susan, Madam Susan? Hello, Susan. Participants, anyone who would like to make a remark as we invite participants? Are you there? Participants?
Yes, we are there.
Yeah.
Anyone who can make a remark? This is Sally. Closing remarks from the participant as yes, please.
I appreciate the facilitators. Personally, I've learned so much in PFM and budgeting and all that in the government sector, and I think it will go a long way in helping me to execute my mandate as a manager, and I really appreciate. So thank you so much for your input.
Thank you so much, Sari. I believe this one is a representative of the Susan Chesang. Any remarks? Thank you, Sari. Susan? Susan Chesang? Okay, we seem not to be in touch with Susan. I think, Sari, I was saying that I believe your remarks is a representation of the class as a whole. And we wish also to wish you all the best. Please, you are going to be our ambassadors. From the look of things and how you address the questions, the values, you have them. Our worry is, why do we still have so many issues in terms of ethics in the various support functions in the various departments that we work in? So it should be a turnaround now that we've been into this class. When we go out, let's be good ambassadors, and we be the agents of change. Thank you very much. And I would like to invite Madam Susan as now in the heart of a coordinator to make her remarks as she closes the session.
Hello, Ishmael.
Yes, Susan? Yes, Susan, proceed.
Okay. Ishmael.
Yes? Susan, yes.
Okay.
Proceed.
Thank you very much, Ishmael. Yes. Thank you very much, Ishmael and Madam. Yes. And Dr. Amoni. I don't know. Am I hanging or something?
Yes,
Susan,
it's
you are
fine.
breaking. I think you are hanging. I think we need to
Are you getting
invite
me?
a participant to pray for.
Hello.
You are breaking. Hello. Now you can. I can hear you. We can hear you. Hello.
Hello.
I can hear you.
Hello.
Hello, Ishmael.
Yes, Susan, I can hear you.
Hello.
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 You're not getting.
I can hear you.
want us to have Dr. Mirara? Okay.
Is Dr. Mirara on board?
No, yes, thank you very much. You're getting me now?
Yes, yes.
Yes, Dr. Mirara can take up that. I can.
Dr. Mirara? Is Dr. Mirara on board? We don't have Dr. Mirara on board. Dr. Monyi? Dr. Monyi?
Yes, Ishmael.
I think
Yes.
we need to close because Susan seems to be having challenges and I cannot see Dr. Mirara on board. It's like she was proposing that Dr. Mirara was to come online.
Yes, he was supposed to guide them on a few things on research.
Yes.
Unfortunately, I've not seen him on the forum unless the class president has had any contact with him.
Okay.
Do you have any communication from the class president?
No, I've not seen any communication. I think Susan is the one who had a communication with regard to Dr. Mirara's brief.
Ishmael, Mr.
Yes.
Ishmael.
Yes, please, Faith.
Then we can close.
We had spoken with Dr. Mirara.
Faith.
Yes, Faith. Yes.
Susan had spoken with Dr. Mirara just to guide the groups on data analysis. So I think we just give him a few minutes.
Yes.
Yes.
Okay.
As they sorted themselves out.
Okay, that's fine.
Yeah, I'll try to call Susan also to fast track.
Okay.
Yeah.
So we can exit as they wait for Dr. Mirara. Ishmael, is that okay for us?
So we need, we need to give Dr. Mirara some few minutes so that once we start exiting, almost everyone will imply like the session has ended. Susan, I can see Susan has come in again.
Yes.
Have you found Dr. Mirara? Susan? Susan?
Hello.
Yes.
I'm on mute. You're getting me now?
Yes. Yes.
Okay, I think even Dr. Mirara is on board now. Hello.
Yes, I cannot
Ishmael?
see Dr. Mirara on board. Yes.
Now you are
Dr.
getting
Mirara?
me.
Dr. Mirara? Dr. Mirara? We can't hear him.
Okay, Ishmael.
Yes.
I was saying thank you very much, and I was appreciating your coordination or the way you've done this session. Thank you very much. And I think participants, you've learned a lot on this module. And as I've always said, the end is not the end. There's no going back to that module. Our facilitators are always available for you, and we shall be available until the end of your course. So if you have anything that you still feel like you need clarification, you can still get in touch with us. Am I right, Ishmael?
That's right, Susan. That is true. We are available to clarify any areas that may require clarification before the closure.
Okay.
Thank you.
Yes. Now,
Susan, I propose we close the program.
I don't know. Like I don't know if that is shaking, but we had talked.
Since I cannot see Dr.
Yes.
Mirara on board, I think
Yes,
it is
that's what
we are going. We end so that we also allow the participants to rest.
What we are going to do, Faith, We're going to organize with Dr. Mirara. Yes. We shall organize a special meeting for research project process with Dr. Mirara. Is that okay, Faith?
Susan, I think, Madam Susan, we are not getting communication because you are breaking now and then. I think it is safer that we finish the session, then you get in touch on phone and arrange on how Dr. Mirara can interact with each participant on the data analysis I'm advised.
Hello? Yeah.
Susan, can you hear me? Participant?
Exactly, that's... Yes.
I think we seem to be having challenges with communication.
That is okay, we can end the session. Yes, we can end the session now.
We need to end the session, perhaps with a volunteer from the floor to finish with a word of prayer, hoping that Susan will take it up and deal with the issue of Dr. Mirara having to share his thoughts about, I think it's the project research in terms of data analysis. That is where the participants need some help. Somebody from the floor? Sharon, to lead us with a word of prayer.
Yes,
Thank you.
I want to pray. Okay, let's pray. Father, in the name of Jesus, thank you, Lord, because of this section. Thank you because of all God's word. Participating in this program. Lord, we love you. May you forgive us in this time of Corona. Lord, we ask request you to be as we go to sleep or prepare for anything, Father, may you be with us and tomorrow. We pray trusting in His name.
Amen.
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 Thank you very much. Very grateful for having you this
Good night.
Asanteni sana.
Amen. Good night.
Good night. Good night.
Good night.
Good night.
Good night.
Good night.
Usiku mwema.
Go back to the sitting room. I'm coming.